Good afternoon, and thank you for joining us. Today is Wednesday, May 6th, and we're here to give you some information for the Riley County Coronavirus Daily Update. We've switched to Mondays, Wednesdays, and Fridays, so that's going to be the schedule moving forward. As always, if you have questions for the group, please feel free to leave them in the comment section. We'll do our best to answer them during the live update, and if not, try to get back to you via text later on. Got a new face here today, Andrew Adams, who is the Riley County, Andrew, remind me of your title.
Public Health Emergency Preparedness Coordinator.
That's a long one. Thank you so much for joining us today. As always, Local Health Officer Julie Gibbs will share some information about the situation. And we have Assistant Director of the Riley County Police Department, Kurt Muldrip, as well as ASL interpreter Tony Kroll from iSign Interpreting. My name is Vivian Uccello, and I am the Public Information Officer for the City of Manhattan. Julie, will you start us off with an update for today?
Sure. Hi, everyone. As of today, May 6th, Kansas has 5,734 positives statewide. There are now 571 hospitalizations, and there have been a total of 144 deaths in Kansas. Here in the county, we are still sitting at 55 confirmed positives. That's 3 days in a row now without a positive case. 35 of those have recovered, leaving us with a total of 20 active cases, which we are still monitoring. We also have 55 pending tests, and there have been a total of 544 negative tests in the county so far. We still have one Riley County resident in the hospital. We are still encouraging those of you with symptoms to call our screening line at 785-323-6400. This is available every day from 8 a.m. until 10 p.m. Again, that number is 785-323-6400. We are still encouraging anyone with general questions to please email us at rileycountycovid19@gmail.com. If you are a business owner with questions about opening your doors or about specific guidelines, please email info@manhattan.org, or you can call the chamber hotline at 785-776-8829. Please have patience as we may be receiving a high volume of calls at this time. Again, that number for business owners is 785-776-8829. We are glad to hear that so many businesses have opened their doors again, and they're doing so in a very controlled manner, taking every precaution necessary. From what we have seen so far, most retail businesses and restaurants are following the guidelines and best practices to open up this week. Please keep in mind those businesses who are following the best practices are far less likely to have a COVID positive case associated with their business, and therefore are more likely to stay open. The command staff have been in discussion about the next phase and what guidelines will need to be in place for more businesses being able to open. Keep in mind, though, that we could stay in this phase longer than 14 days if necessary. We, of course, will be following guidance from the governor when she announces this next week. All of us here at the health department and everyone within the EOC would like nothing more than to get back to normal, whatever that may look like. To get there, we need everyone's help. Even though more businesses are open, that doesn't mean that we should forget everything that we've been doing so far. Please only go out if you really need something. And when you do go out, please wear a mask. Also, it's important to continue to avoid any unnecessary travel, as indicated by the governor. I, like many of you, would love to travel to my hometown for Mother's Day, as I traditionally do. However, it's so important to stay the course so that we are able to travel in the very near future. Remember, you're not only protecting yourself, but others as well. Thank you.
Thank you so much, Julie. Moving forward, the governor has said that we're going to measure our progress by a few different things: monitoring testing rates, COVID-19 hospitalizations, the ability to perform that very important contact tracing, and the availability of personal protective equipment. I just wanted to kind of ask the question, when will we know locally what effects the reopening has had on virus transmission for our community?
I think we'll be able to start to see this next week. As we know, it takes a good 2 weeks to be able to see the effects of this. So probably next week sometime is when we'll start to see the effects. We are planning for phase 2 now. And of course, we'll have many different plans in place depending on what our situation looks like, but it usually takes a good 2 weeks before we can start to see the effects.
So I know we've been talking kind of since the beginning, and this is the global health guidance that people should quarantine for 14 days if they've come into close contact with someone who has tested positive. Can one of you talk a little bit about what's the typical, I would say, incubation period for the virus? What do you see most people coming in with?
Right. So like we've said from the beginning, typically a coronavirus has an incubation period anywhere from 2 to 14 days. So we've seen as few as 3, 4, or 5 days after their potential exposure, or we've seen some people on their 14th day of quarantine, thinking they've been healthy, they're ready to return back to normal, and then they get sick. So really that wide range is there for a reason. It is based on historical data from other similar diseases and from what we know about this disease already. So anywhere, I think the average time is between 5 and 11 days or so, but anywhere from 2 to 14 has been the incubation period typically.
All right, thank you for that, Andrew. As part of the social distancing requirements for the public and for employees during this reopening process, people are being asked to keep up with those good practices, staying 6 feet apart from people not in your own household, washing hands frequently, using hand sanitizer, and we are strongly encouraging the use of face masks. If people aren't able to find masks, what should they do?
Sure, you can easily make your own mask. We do still have that guidance on our Riley County Health Department Facebook page showing an actual video of how to make a mask. It's very easy to do. If you want to have one that's already made for you, you can drop by the Westview Community Church anytime from 11 to 3 on Mondays, Wednesdays, and Fridays, or from 9 to noon on Saturdays. They are located at 615 Gillespie Drive, and you can pick up a mask from them. They are still limiting 3 masks per family, but they are there as a distribution site, and they're also there as a donation site. So if there's somebody in the community that would like to make masks, we are strongly encouraging donations.
Thank you so much for that, Julie. And I know that they've received quite a lot of donations and have distributed a large number of masks. So thank you so much for all the volunteers who are making that happen, and for the people in the community who are making the masks for others to use. That's a great generosity of spirit, and we appreciate that so much. In some instances, like the employees at restaurants who are preparing and handling unpackaged food, they are required to wear commercially made surgical masks. Can you talk, can you reuse those masks for multiple shifts?
Yeah, you can if there aren't others available to you. So the important part to remember with those masks is that if you are to reuse them, make sure that they're not soiled in any way, that they're still structurally sound. The elastic on the earpieces is still okay. There are no holes or stains or anything like that, and you can reuse those a couple times, but not too many times. And especially if there's more masks available to you, we would recommend using a new one each time.
Okay, Julie, did you have any other comments? Shall we move on?
You can move on.
Okay. Andrew, this is another question for you. You developed a community survey to kind of get some more information about how the virus has progressed in Riley County. What can you tell us about that survey? It ended on Friday, correct?
Correct. So it ended on Friday. We closed it Friday evening, and we actually had about 4,300 responses, which is more than I could have imagined when we started it. So that's fantastic. I'm glad everybody's thinking about public health right now. Of those about 4,300 responses or so, about 4,100 were from Riley County residents. And so from that pool of information, we distilled it down a little bit more to people who reported having symptoms and people who reported not having any symptoms. And we had about 5% of those responses from Riley County residents reported having some kind of symptoms similar or related to COVID infection or similar to the symptoms of COVID. And from that 5% of responses, we went to 15% of those responses mentioned they would be willing to get swabbed if possible. So with that information, we're working behind the scenes with our swab site partners, with our medical director and the healthcare providers associated with the swab site to figure out the best way, the most efficient way to contact those people back who are willing to be contacted again and to get them tested if possible, or swabbed to be tested if possible. So more on that to come as we work out more of the details, but hopefully here shortly.
Thank you so much. Jumped over to the Facebook page real quick to see if the public had any questions. And there was one in particular related to symptoms, and testing, I suppose. Someone had a question. They themselves had some severe respiratory symptoms, were tested, it came back negative, and they're expressing some worry and wanted to know, have there been a lot of false negatives? Can you speak to the reliability of the test?
Sure. So I don't know that number, that percent off the top of my head. I will look that up and get that back out there to everyone. I will say the way that the testing does work is that it detects if that virus is present at the time of swabbing. So there's a good chance for anyone who's tested that doesn't have symptoms or maybe is a contact of a case who has been tested and comes back negative to develop that later. And we've talked with our contacts through our contact tracing protocols and procedures, helping to relay that message on that just because you've been tested right now doesn't mean you're out of the woods if you're a contact of a case. That's why we do quarantine for those full 14 days, because maybe they were swabbed on day 3 after contact, and it might take that full, there's 11 more days in that potential incubation period. So I will look up that number and get that back to you to get out to the public on the reliability of that swab.
Okay, thank you so much. And if anyone does have medical questions or wondering if their symptoms might be COVID-19, or even for this person who is tested and perhaps has another virus or another issue, we encourage you to contact your healthcare provider. First and foremost, reach out. They're doing a lot of telehealth appointments. It's easy to accomplish those from the safety of your home. Doctors' offices are taking a lot of precautions to keep their staff and patients safe. So it is safe to go visit your doctor at this point, but we do encourage you to reach out to them directly for advice on medical questions. You can also call that screening hotline at the Riley County Health Department to speak with a nurse there. Again, that phone number is 323-6400, 323-6400, and that is staffed every day. Julie, we're getting a few more questions coming in about masks, whether they are required or recommended for the public, and in what situations should people be wearing them. Oh, Julie, you're muted. I'm sorry.
I knew I was going to do that. Right now, they are strongly encouraged, strongly recommended for the public to wear a mask, especially if you're going to be in an instance where you cannot have that social distancing of 6 feet between you and the person. It's unknown. When you go out to the store, you don't know how many people are going to be there. You can't always judge it by the parking lot. So I would highly recommend just to wear a mask when you go out. So that is our recommendation, and the CDC's recommendation as well.
Okay, thank you so much. Switching gears a little bit, the Recovery Task Force appointed by the mayor is meeting again tomorrow at 2 o'clock. Can you talk a little bit about what's on their agenda?
Sure. So we've been working with this task force very closely to get input from them on our phases and different orders that we're putting out. And like I said, we are going to be working as a command staff this week and have been in discussion about the next phase. So something we would like input from them on is travel recommendations as far as should we allow travel or have a stance on travel. The governor right now has said reduce or eliminate unnecessary travel in this phase. And so that's the stance we've taken on that. But what will next phase look like, and what are some of the recommendations, especially from the healthcare providers, from what they're currently seeing? We're also going to discuss the 50% occupancy level that we're currently working with, or the limit that we put in place for the restaurants for these 2 weeks. Should that stay the same for the next phase, or can we look at possibly lifting that? We also want to work very closely again with Geary County and Pottawatomie County health officials to make sure that our orders, whatever order we decide to put out next, is very similar as we've done this last phase.
Okay, thank you so much. You mentioned kind of in the beginning of your statement that we have a couple hotlines available for people who have questions, both about COVID-19 in general and specifically about businesses and what they can do to reopen safely. Can you talk about how things have been going at the hotlines?
Yeah, so here I know our phone is ringing, but it's very manageable. It's not so much that we cannot handle. We do have staff in place to answer the call line and also to answer those questions that are coming in through our Gmail account. And same at the chamber. We've spoken with some chamber representatives and they said the exact same thing. It's flowing, but it's very manageable. So please don't hesitate to give us a call or shoot us an email if you have any questions.
Okay, thank you so much. Andrew, this next question is for you and has to do with the percentage of males versus females who are contracting the virus or have tested positive in Riley County. Do those numbers match up roughly with the national numbers, or do you have that information right now?
I don't know the national numbers off the top of my head. I can find those again for you too. I do know our numbers are almost a 50-50 split, which, you know, our baseline assumption is usually that males and females would be affected equally at this point. So I think we do have a few more males than females, but I can look up again and compare how it looks at the state level and at the national level.
Okay, thank you so much for that. And I know this is kind of asking you to spout off facts off the top of your head. So thank you for doing that research. I appreciate it. I'm going to continue to pepper you with questions though.
Bring it on.
Okay, here we go. So you are pretty much in charge of contact tracing for Riley County. One of the indications or indicators that the governor cited to make sure counties are prepared to move to those next phases of reopening is the ability to contact or to do contact tracing successfully. Can you talk about your staff? Are we staffed up sufficiently to handle the caseload for our area?
Yes, I believe right now that we are. So we have right around 20 staff and volunteers at this point to help us out with contact tracing. So, and I've said it a few times, and I'll continue to say it. We have our surge capacity plans for our disease investigations. So we have an established protocol where we look at our normal disease investigation staff here internally, and then based on the volume of cases that need investigation or contacts that need followed or traced, we will expand out internally first. And so we've got several staff internally here at the health department, and we've also partnered a couple of years ago. We had a public health intern from over at K-State, the MPH program, and we worked with that intern to establish a student outbreak response team, or SORT for short. So the K-State SORT students, we've trained them on contact tracing long before this pandemic, kind of with this situation in mind. And we've been working closely with those students. They've been volunteering their time over these last about month or so to help us out with the contact tracing process and procedures. And with that, I do think right now we're okay, and we can handle whatever comes to us. It's been good so far too that we've had so many cases recovering. And so once we get to that recovery point, sometimes we have a lull 1 or 2 days with one case or no cases, and then it kind of picks back up. And luckily that little in between time gives us some more time to re-prepare and to kind of recalibrate our staff to make sure that we're ready for that next batch of people that need to be contacted and traced and monitored and followed up with.
That sounds like a really valuable partnership with K-State, get experience for the students. Sounds like a great idea to take advantage of that resource. This again, another question about contact tracing. Do you typically contact stores and places where people have been if they've traveled around the community, or are you just contacting folks they've had that close contact with?
Right. So we will, the very first step is obviously to contact that case, that sick person, and then work back to see where they've been, maybe where they work. And as needed, we'll contact their employers and those things to let them know that an employee has tested positive. From there, once we figure out who their contacts are, we do contact those people as well, and work back that way too. So we work with these cases and the contacts to inform their employers to let them know what the situation is, while still protecting their personal health information. The interesting part about that too is contacting a store and saying, oh, there was a sick person that came through the store on this day. We haven't been doing that for COVID because we want to really only do that when there's something new, some new action that can be taken. If it's a different type of disease, if it's a disease that's spread differently, we would put that information out there. But now, knowing what we know about COVID, the recommendations that have been out, the social distancing, the wearing a mask, the washing your hands, that wouldn't change. If somebody came through this particular store and ended up being sick a few days later. So we haven't been contacting, all the places people have been, but we do keep track of where they've been to kind of look to see if other cases may arise from that.
So if I say you identified a location in town or a business where either several employees tested positive or there was a high number of visitors who had tested positive, would that trigger an action? I think this question is for Julie.
Oh, sure. Absolutely. Yes. So that's part of the whole investigation process too. And so like I said, we monitor where people have been, where they work and all those things. So if we start to notice a pattern, we will reach out and have some suggestions, maybe, clean a little bit differently, make sure you're really enforcing those social distancing guidelines, those kinds of things.
Julie, would there be anything stronger for a case where it seems like a business really was not following the guidelines?
Yeah, it would really depend on the situation, but that's where, like I said earlier, if they're not following best practices, then we might have to close them down, at least for a short time, so that they can clean their area, and they might have a lot of employees who are affected by that. And if you have so many employees that need to be quarantined for 14 days, then you're not going to be able to function. So there might be some instances like that. That's why we strongly recommend following those best practices. And there are requirements set in place according to the order that restaurants and retail businesses do have to follow. So we will be on the lookout in these next few weeks to just make sure that they're following those things. And we do have a number of people that will call in and let us know if a certain business isn't. And we do check up with them, of course, with the help of our CPD, we can follow up on that. But we highly recommend to follow those best practices and, of course, follow those requirements that are set forth in the order.
Julie, do you have any advice for the public about visiting businesses and kind of how they make the choice of where to visit and how to keep their own family safe?
Yeah. Well, overall, I would just say, listen to your gut. If you walk into a place and you see that there's just a lot of crowds in place, or if you see that the lobby area is full, or that the restaurant employees are not wearing masks, the more that you know, and the more you can trust your instinct on that. And you can always let us know, call our hotline or email the Gmail account and let us know about that. But certainly use your best judgment. And you may not want to go into a place like that if you see that there's a lot of crowds and people are not social distancing. And then above all of that, just make sure that you yourself are practicing good hygiene and that you are practicing that social distancing and wearing the mask when you can.
Thank you so much. Very good advice. Andrew, this is one more question from the Facebook page regarding contact tracing. Specifically, do you let employers know if they have an employee who has tested positive?
Yeah, if as needed, but yes, we will, provide that information. We offer that we will provide a letter or something like that to that employee to let their employer know that they've tested positive. Again, we'll take it kind of on a case by case basis in terms of letting, corporate know or the owner know. But a lot of the times, once we've gotten a test result back, once we've gotten a positive test result back, and we make that initial contact with that patient, that said, yeah, I wasn't feeling good, and I talked to my boss and they told me to go home. So, from my experience with the public so far with all this, with talking to the patients, it seems like their places of employment have been really on board with prioritizing their staff safety and health, and their customer safety and health as well.
That's good to know. Kurt, you've been sitting there listening so patiently. Thank you. This question is actually for you. We've been talking for the last few weeks about the volume of 911 calls and people's perhaps reluctance to either call 911 or seek emergency medical services. Can you talk to us about what we've seen here locally?
Yes, I sure can. But before I do, I want to just kind of give a shout out to Andrew and Julie in the health department. Something that Andrew had said earlier reminded me of this when he talked about having the student volunteers that they had already been working with before this pandemic came. And I think it's important to point out to the public that the health department, our local health department, as much as you can be for something like this, was well prepared. This didn't catch them off guard as far as a pandemic that they'd been preparing. We'd even had recently had a tabletop. So I think it's important that the public knows that they were doing their due diligence well before this occurred, and so we've been well prepared for it, I think. So kudos to them. Now,
Kurt, I'm going to interrupt you really quick and ask if you could explain what the term tabletop means.
Yeah, tabletop exercise is something that emergency services do, cities do as a way to talk through a potential emergency. So it's just kind of planning on what you do, and you get the various agencies that may be involved together and have scenarios laid out, and then kind of walk through what you would do, what we would do, what plans you need to put in place to help us all communicate ahead of time on the expectations and know what each other would do. So we're not finding out during an event, hey, I didn't know that was our responsibility, or we don't have equipment for that, et cetera. So it's helped us have forms and plans already ahead of time, as well as relationships, which is really important, and I think has been very beneficial in our EOC. These relationships were established well before this pandemic.
I think that's where I first met you, in fact.
Flood.
Flood. But back to,
yes.
Thank you for sharing that. But yep.
Calls for service. The 911 and generally our calls for service have been down during this pandemic. And there's lots of reasons why, a lot of variables that can come into play. Some are obvious. We have a lot less people in our community right now because there are many students gone. So you have a smaller pool of potential victims and a smaller pool of potential perpetrators. So that naturally is going to reduce it. Also, it's true across the country that those cities, communities that had stay-at-home orders, as everyone could see when they did move around, there was very little traffic out. And so that reduced a lot of our calls for service because people were doing what they should be doing and staying home. Traffic accidents were down by over 60%. So that's a good sign. And I think we've all heard that some of the insurance companies have even done rebates because traffic accidents are down, and they do that on a risk analysis. But overall, crime has been down, and I think it's a positive thing. It also shows, community, we can do this by staying at home and not going out and committing crimes. Maybe we ought to come up with a rule. But 911 calls are also down for, again, a lot of reasons. The important thing, though, we want to continue to emphasize is we don't want them to be down because people are afraid to call 911 for an emergency service, especially medical, because they don't want to bother, don't want to overwhelm anyone, and that's not the case. EMS is, I think Dave talked about his call for service are down as well. They're not overwhelmed. EMS can respond, and we want to get to the medical issues early, as always, to treat them. So call 911 when you have an emergency, and see your doctor when you have a medical issue, as well as go to the ER if you feel that you need to.
Absolutely. Thank you so much, Kurt. And thank you for all the work that you and your team are doing to keep the public safe. I know it's not always fun, but we appreciate you staying diligent. Thank you so much for that. One perhaps final question, this also is from the public. We might not have these answers, but do you know if there are safeguards in place for employees who might have been told to quarantine? Is it in terms of layoffs, is their employer required to keep them on as an employee? Are they in danger of being fired if they comply with orders to quarantine or isolate?
So they are not allowed by state statute to terminate an employee for being on quarantine, for an immediate family member being on quarantine that they have to take care of, or being isolated. So if they're sick, they should be protected under state statute. I believe 65129 section C or D, one of those. But it's,
can you be
it's
more
in there.
specific?
Right. Let me grab my book. Yeah.
If somebody has questions about that or wants to know what their rights are, do they visit the state page, or where could they find information about that? I think it's the state page. Go to kansas.gov, and you should be able to click through to find resources about that very question. Let me check the Facebook page one last time to see if there are additional questions. Dun, dun, dun. I think that's about it for now. I mean, in the interest of time, do you guys have any final thoughts as we're kind of heading into the weekend? And again, as Julie said, Mother's Day is coming up.
Yeah. Just to remind people to stay the course. We're hopefully we'll see the light at the end of the tunnel. I think that we've already started to see that with the lifting of the stay-at-home order, but we just need to go about it now slowly. As we are opening our businesses in a very controlled, slow manner, we need to act the same as individuals. I do want to give a shout out to all of our nurses. Today is National Nurses Day, so I want to recognize our nurses here at the health department, but of course, all of our nurses in the community that are doing tremendous things every day. Thank you.
I'm going to follow her lead on that. This is also National Corrections Officers Week. And so I want to do the same thing and thank all of our corrections officers throughout the state, but specifically here in Riley County, the Riley County Police Department at their jail. They have done an amazing job. They're kind of unsung heroes too. People don't think much about them. They're out of sight, out of mind. But want to point out that it's a difficult setting to be in, and they've done a very good job of keeping those inmates safe and from the having any outbreak of COVID within our jails. You've seen Lansing and some of the other prisons have had that, and they've taken some very good measures and are keeping those people that don't have a choice now that they're in there to move around. And so shout out to those guys and girls who are doing a phenomenal job day in and day out.
Thank you. Always good to remember. And thank you for joining us for this update. We will be back on Friday at 4:15 with another live update. You can find information in the meantime online at rileycountyks.gov/coronavirus. Again, that's rileycountyks.gov/coronavirus. Continue to ask questions, and we will do our best to keep you all informed. Thank you so much, and take care.